so today we're going to insert a Foley catheter for our patient. I'm just going to first check the order and make sure that we're putting on the right patient and that the physician ordered it. Hello, my name is Chelisse. I am a registered nursing student at the Northwestern State University. We're going to go ahead and insert a Foley catheter on you today. But first, can I go ahead and get your first name, last name, and date of birth? Okay, good. So do you have any allergies? Okay, what about to latex or adhesives? No? Okay, good. At this moment, I would also educate the patient on how we're going to be inserting the catheter and why we're going to be doing it based on what the physician ordered. I'm raising the bed to waist height. I'm going to lower the bed rail, uncover the patient, and get him ready and in position. We're going to put him into dorsal recumbent position. And then we would typically drape the patient for this procedure, but for the purpose of this video, we're not going to do that. Alright, so now I'm going to go ahead and prepare my field. Right here I have a trash can to use. I'm going to use this as my trash can on the bed during the procedure. We already performed pericare, and I'm also going to assess the area and make sure that there's no skin breakdown or irritation, and there's none. I would do hand hygiene again, and then now I'm going to go ahead and set up my sterile field. I'm going to maintain sterility by just touching the 1-inch border of the paper. Now I'm going to go ahead and grab this sheet and I'm going to place it on the bed right under the patient's shiny side down. Now I'm going to go ahead and slide it, and while I'm sliding it, I'm still maintaining sterility because I'm touching the 1-inch border. Now I'm going to go ahead and put on my sterile gloves. As I put this one on, I want to make sure not to touch my thumb on the glove to break sterility. Okay, now I don't need that anymore. I'm going to go ahead and get my box ready. So first I'm going to take this plastic off, and I want to be careful not to let it swing so that it touches outside of my field. And then next I'm going to put in my syringe, but for the purpose of this video it's taped since we had complications putting it together after first use. Normally I would just take off the little cap, push it in place, and then just leave it be. Then I'm gonna get my lube, go ahead and open the lubricant, and I'm gonna add just a little bit on my box. And I'm gonna go ahead and lubricate the tip about 2 to 3 inches for easier insertion. Now I'm gonna pre-open my swabs that we're gonna clean her with to get it ready for the field, the procedure. Now I'm ready to bring this to my field. Now we're going to go ahead and clean her before we start the procedure. So I'm going to commit my left hand, open up the labia. I'm going to grab a swab and do from outside in. I'll do front to back. Go ahead and drop it. Now I'll do front to back in the middle. Alright, so now I'll go ahead and move this, and now we're going to begin the procedure. First, I'm going to tell the patient that this is going to be just a little bit of pressure, and to void down right before I insert the catheter. So I'm going to make sure that it's really lubed up well. I'm going to go ahead and insert it. Tell the patient to void down and keep inserting it. I'm going to insert it until I see some urine flow out, and then go about 2 more inches afterwards. Now I'm going to fill up the balloon, so I'm going to hold the catheter. And then I'm going to put in about 10 millimeters of water into the balloon to fill that balloon up to keep it in place as an anchor. Alright, so now I'm going to keep hold on the plunger so that it doesn't bounce back at me, and I'm going to check if the balloon is in place, and it is. So now I'm just going to go ahead and take this tape off, take off the syringe. And then I'm going to tape this onto the patient's skin. But first, before I do that, I want to make sure that the integrity of the skin is well enough to hold the tape so it doesn't irritate or cause further irritation if there's already irritation. You want to leave some slack so that if the patient moves, it doesn't pull and cause irritation.
I'm not worried about no real day where I'm half hurt, half hurt.
Alright, now I'm going to go ahead and take the bag, and I am going to label it. And it looks like there's already about 50 milliliters of urine. It's clear, pale yellow, and it's not cloudy. It's pretty clear. Now I'm going to secure this to the bed, but not the bed rail. And I would document how the patient tolerated the procedure, all the urine characteristics, and that I educated the patient on the catheter. I would also tell the patient that they need to keep the tubing of the catheter over the leg. Now I'm going to go ahead and just throw this all away. And then I'm just going to grab my pen, and I'm going to label the bag with my name, the time, and today's date. I'll go ahead and throw this away also. Perform hand hygiene and reposition the patient. I'm going to tell the patient that I'll be back in about 30 minutes, and if they have to get up to use the restroom, to use the call bell so I could help her get up. I'll raise the bed rail, give them the call light, and start lowering the bed. We want the bed to be low for the safety of the patient, but we don't want the catheter bag to be touching the floor. Okay, so then I'll let them know I'll be back in 30 minutes. So now I'm coming back in to go ahead and take off the Foley bag. the catheter. But I'm first going to check the physician's orders, and he said to take it off, so I'm going to take it off. I'm going to bring all my supplies over here, hand hygiene, and then I would introduce myself again and get the 2 patients' identifiers as well as any allergies, reassess for allergies. And I'm going to explain to the patient today I'm going to be removing your catheter as your physician ordered, and then I'm going to educate the patient on what comes with removing it, which would be you don't want them to get out of bed and use the restroom without you to call you first for that first initial void. So then I'll lower the bedside rail. We'll bring down his blankets again, and we're also going to put her in dorsal recumbent again. Same thing, we're not going to drape him just for her for the purpose of the video. We want to add, to protect the linen so I don't have to do extra work, I'm going to add some linen saver pads. And I'm going to apply some clean gloves because it's a clean technique. And then I'm going to get another syringe, and I'm just going to take out all the liquid that we have inside. I'm also going to tell the patient that removing it shouldn't be painful. And then I'm going to do it one more time to ensure that we got all that air out until I feel a little resistance. Looks like we got it all out. And then I'll untape the patient, and while I'm doing this, I'm also assessing the patient's skin integrity, making sure that there's nothing wrong. If there was, since there isn't, I'm also going to document that, and I'm also going to assess the patient's vagina. Now I'm going to tell the patient to take one deep breath in and then out, and I'm going to pull it out, and then I'm going to place it there, and I would assess the ending of the catheter to see if there's any blood or anything, and I'm also going to assess how much liquid there is in the bag, and there's about 400 milliliters. It's pale yellow and it's pretty clear, and I'm going to document both of those assessments. And I'll just go ahead and grab this, and I'm going to go ahead and throw it away. And then I'm going to take off my clean gloves, throw that away. If I need to do pericare at this moment, because I feel like it's necessary, I would do it with warm water, mild soap, and a washcloth. Redrape the patient. And then again, I'm going to educate the patient and let them know to use their call bell. Do some hand hygiene. Use the call bell to let me know if they're feeling any pain or if they feel like they need to void so I could assist them to the restroom. Here's the call bell. I'm going to lower the bed, and I'll be back in 30 minutes. And I'll bring their table next to them.